Several years ago, I came to Dr. McCullom, and she suggested that I have my wisdom teeth extracted along with what seemed like enormous amount of gum surgery, and that just did not sit well with me.
I knew some of the history behind when you have a periodontal issue, and that sometimes people lose their teeth, or the circumstances are so far gone that it just takes so much more to bring the mouth back to the beautiful state that it usually starts in.
I'm right now 69 years old. I have all of my original teeth, and that's just the way I intend to go to heaven, was with all of them.
Gum disease is an infection in the mouth that can cause the loss of teeth because of the breakdown of the bone that supports the roots of teeth. In the presence of this infection, the bone around the teeth breaks down and perfectly healthy teeth can become loose and fall out. Gum disease affects over half of the adult population. Signs and symptoms of gum disease include bleeding, loose teeth, and shifting teeth in its later stages.
Roughly almost a year ago, I had an abscess on one of my two front teeth. So I came back to Dr. McCullom, and that's when she recommended LANAP, surgery.
With the laser treatment, it was where I wouldn't have to have my gum cut at all. And that appealed to me because I was already terrified because I knew that I had a periodontal issue.
The LANAP surgical protocol allows me to more quickly and effectively treat gum disease than the way I used to care for patients. I no longer have to use a blade and suture. Patients are able to return to work pretty quickly. They can get up and go back to their regular routine within the next 24 hours.
And I must say, although I was very nervous, as the procedure was conducted, it was absolutely excellent. Like, I didn't feel any really discomfort. I felt very enthusiastic, and I was really glad that I had taken the opportunity to allow her to use the laser surgery for my gums.
I had periodontal surgery done maybe 15, 20 years ago, and I must say that this technique was off the chart in terms of differences. It was absolutely pain-free, and the recovery period was very different, and I would recommend it to anyone, even those who have the kind of phobia I do about dentistry.
During the LANAP protocol, the laser is used to achieve surgical access to the underlying root and bone. The teeth are then cleaned thoroughly, and then the laser is used to create a fibrin clot. The teeth are also adjusted to make sure that the bite is comfortable for the patient.
When I left after the surgery, I think she'd given me a prescription for pain medication, and I don't even recall that I really even took any of it.
My recovery was absolutely painless. The greatest challenge I had was just being mindful of what I could not eat. But beyond that, it was absolutely a post-operative success story.
The advantages of the LANAP protocol are that it's easier for patients to accept treatment, and they're in and out of care a lot more quickly. The surgical results are as good as what I used to do in the past, so it's a win-win situation for everyone.
I feel like the results are awesome.
I would say that within 2.5 weeks, I was absolutely back to normal activity.
I feel good about the original decision not to have all of that gum surgery that I've heard other people talk about, and how it is just really, really bad. And I didn't do that. But having this, seen, I waited long enough, the technology caught up with me, and here I am.